Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I am joined this afternoon by Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Commissioner Wambrew and I are happy to be able to join you this afternoon to provide you an update and discuss with everyone where we are with respect to all things COVID-19 for the entire state of Maine for today, Tuesday, March 9th, 2021. I'll start by providing an update on where we are from an epidemiological and public health perspective, and then turn things over to Commissioner Wambrew for some updates on her side. And I begin my updates this afternoon with some sad notes. Maine CDC is currently reporting 17 additional deaths among individuals with COVID-19. Now that's a large number, but this process and these deaths are related to our ongoing efforts to query our vital records system to look for individuals whose healthcare providers have determined that COVID-19 was a cause of their death. As I've talked about, we undertake this process on an ongoing basis, where we scan death certificates to determine or look for signs or codes that providers use, so-called ICD codes, that providers use to signify whether a person had COVID-19 and whether that COVID-19 played a role in their death. We do this in an effort to make sure that our epidemiological picture is as clear and complete as possible. The 17 deaths that we are reporting today are all as a result of that process to make sure that we are accurately capturing the impact of COVID-19 on our state. These deaths were among individuals whose death certificates were filed between February 17th and March 4th. And all of the deaths themselves occurred either in January, February, or March of 2021 for 16 of the deaths, and for one of them, a person who died in November of 2020. These 17 additional individuals bring our total death numbers in Maine of individuals who died related to COVID-19 to now 723. It's almost 2 deaths per day throughout the pandemic among individuals who were affected with and died with COVID-19. We'd like to take a moment to offer our deepest condolences to all of the friends, family members, and communities of all 723 of those Maine people who have died in the past year. Overall, across the state, there are now a total of 46,059 cases of COVID-19. Of those, 35,974 are confirmed cases, and 10,085 are probable cases. Cumulatively, 1,580 people have been hospitalized. And right now in the state, 75 people are in the hospital with COVID-19. 21 of them are in the critical care unit, and 7 are on a ventilator. Turning now to some updates on where we are with respect to testing. The 7-day positivity rate in Maine now stands at 1.44%. And our PCR testing volume stands at 615 PCR tests that are being conducted for every 100,000 people in Maine. With respect to antigen tests, the 7-day antigen test positivity rate now stands at 4%. And there are an average of 153 antigen tests that are being conducted for every 100,000 people in the state. And finally, an update on vaccines and vaccinations. Overall, Maine has administered 430,790 COVID-19 vaccine doses. Of those, 274,606 are first doses, and 156,174 are final doses. As a reminder, individuals who are receiving the Johnson & Johnson vaccine, those numbers are tallied for and accounted in our final dose numbers. To put those numbers in a bit of perspective, as of right now, more than 1 in every 5 Maine people has received at least their first dose of COVID-19 vaccine, and more than 1 in every 9 people has completed their COVID-19 vaccination series. We've, in the past week, accelerated the volume of COVID-19 vaccines that are being administered every single day. We are now doing over 10,000 shots per day, up from about 7,700 about a week ago. We've got more work to do to keep that expansion going, but that sort of acceleration, over 30% over the past 7 days, suggests that we are on a good pathway, even though we've got a long road ahead of us. I'd like to now turn things over to Commissioner Wambrew for updates on her side. Commissioner?
Thank you. I am pleased to announce a new free option for Maine people who need a ride to and from a COVID-19 vaccine appointment. The Maine Department of Health and Human Services is partnering with Motive Care, one of the organizations that coordinates transportation for Maine Care members, to provide rides for any Maine resident who is unable to drive, lacks reliable transportation, or is otherwise unable to travel to his or her appointment. Motive Care will in turn partner with community action programs and transportation companies to provide these rides. This option is in addition to the transportation support already offered to Maine Care members. The department can provide transportation for appointments that are scheduled Monday through Saturday from 7 a.m. to 4 p.m. At least 48 hours before your vaccine appointment, you should call 1-855-608-5172 to reserve a ride. Individuals already eligible for rides through Maine Care should schedule rides as they usually do. This new transportation option helps residents who may struggle to get to and from a clinic for a life-saving vaccine. It is a new tool to promote equity in Maine's vaccination plan, and we're excited to announce it today. And with that, I'll turn it back over to you, Dr. Shah.
Thank you, Commissioner. Before we turn to some questions from our colleagues from the media this afternoon, I'd like to take a second to provide some perspective and talk about a document that the US CDC released yesterday. Yesterday, they issued a guidance document to help individuals who have been fully vaccinated navigate and think through what sorts of social activities are low risk versus still higher risk. I'd like to take a moment to walk through what the US CDC has said and how that document applies to the more than 1 in 9 Maine people who have completed their vaccine series. But first, a few notes on who and where this document applies. Let's start with the who. A really important piece of this new guidance document is the focus on individuals who are fully vaccinated. I want to talk about what that word fully means in the context of vaccines. Getting your COVID-19 shot is a big step, but it's not the final step. When we talk about folks who are fully vaccinated, we mean individuals who have had at least 14 days after completing their vaccine series. If you're getting the J&J shot, that means 14 days after your one and only shot. If you're getting the Pfizer or Moderna shots, that's 14 days after your second shot. Now, why does this 14 days matter when we talk about being fully vaccinated? Well, during that 14-day period, that's when your body is priming its immune system to be ready to fight the virus if you encounter it later. So what I want to talk about today applies only to those individuals who are fully vaccinated, those who have had at least 14 days since their since their single shot of J&J or since their second shot of Pfizer and Moderna. Another important note, where does this document apply? And the US CDC was really clear. This guidance, which I'll talk about in a moment, applies to private gatherings inside homes, not gatherings that may occur in public settings. It doesn't apply to workplaces. It doesn't apply to healthcare settings. It applies to get-togethers among friends, among families, inside private residences. Now, again, I'm going to talk about in a moment what the document says, but I want to talk about why I'm talking about it. Let's be frank. The pandemic has been hard for all of us, but the stresses of the pandemic have affected some more than others. For example, the pandemic has meant that families have not been able to be together. It's meant that friends have not been able to share a meal together at someone's house. And for so many Mainers, it's meant that grandparents have not been able to visit, hug, and embrace their own grandchildren. All of that has brought challenges of every stripe and every dimension to every part of Maine. But if you are a Mainer who has been fully vaccinated, some of those strictures can and should start to change. Why? Well, the things I'm going to talk about in a moment are made possible by the spectacular science underlying the vaccines that we have. I mean, who would have thought just a year ago, almost a year to the day after our first case in Maine, we would be sitting here talking about what you can and can't do after you've been vaccinated. So let's get into that. As a result of the spectacular science underlying these vaccines, fully vaccinated people who have, again, been 14 days after their completion should now be able to visit with other fully vaccinated people indoors without wearing masks or physical distancing and be at low risk. Again, fully vaccinated people should feel open to visiting with other fully vaccinated people indoors without wearing masks or physical distancing and consider that a low risk activity. Fully vaccinated people may also be open to visiting with unvaccinated people from a single household who are themselves at low risk for catching COVID or suffering from COVID-19. And they should feel open to doing so indoors without masks or without physical distancing. So what does this mean? Well, it means that if you're a Mainer and you want to get together with other folks who have been fully vaccinated for dinner at someone's house, you should feel free to do so and not feel the need to wear masks or physically distance. You're still free to do those things, but doing so after everyone has been fully vaccinated without wearing a mask or without needing to distance is thought to be a low risk activity. But that second piece that I mentioned is one that I think is going to be critical. The ability to visit with unvaccinated folks from a single household where those unvaccinated individuals are at low risk for severe COVID disease. Now, what does that mean? Well, it means that if you're a Mainer and you've been fully vaccinated and you want to go see your child and your grandkids, but your kids and your grandkids have not yet been vaccinated, but are otherwise healthy. Your kids are healthy, your grandkids are healthy. And they all are in one household. That too is an activity that is thought to be at low risk. Now, what if the folks that you want to see are at higher risk for severe COVID disease? Maybe they are older and haven't been vaccinated yet, or maybe they're younger, but are at higher risk. In that situation, even though you've been vaccinated, the best advice right now is to continue with the traditional guidance, to wear masks, to practice physical distancing, and try to move the visit outside as much as possible. There are other things that I want to urge for now fully vaccinated folks to continue to do. The first is when you're outside of these private residences and are in a public setting, continue to take precautions like wearing a well-fitted mask and engaging in physical distancing. Wearing masks maintaining physical distancing, as well as the other prevention methods that we've talked about, are useful not just in public settings, but also when visiting with unvaccinated folks who are either at a higher risk for severe COVID or visiting with folks who are unvaccinated from an array of different households. We still recommend that even vaccinated folks avoid medium and large size in-person gatherings. And if you start to develop symptoms, even if you've been vaccinated against COVID, getting tested is still not a bad idea. Right now, as a country and as a state, we are in this odd and uneven period between no longer and not yet. No longer must fully vaccinated folks avoid gathering with fully vaccinated friends. No longer must fully vaccinated folks avoid seeing their unvaccinated grandchildren. But there's still an element of not yet. Not yet should fully vaccinated folks abandon masks altogether, or gather in large groups, or go to raves. We're in this period between when we can leave some safety measures behind, but not yet being completely done with every single one of them. Now, this guidance will change as more folks get vaccinated, as we learn more about vaccines, and as the dynamics of the pandemic change. But I wanted to take a moment today to share this expert analysis from the US CDC in the hopes that, one, it opens up avenues of socializing for those Mainers who have been fully vaccinated, and two, provides some sense of the value of why you too should get vaccinated when your turn is up. The vaccines we have are spectacularly effective, and this ability to gather with other vaccinated folks, as well as to gather with low-risk unvaccinated folks, is proof positive of just how great these vaccines are. So with that, I'd like to turn things over to our colleagues in the media. The first question for the afternoon goes to Allison Ross.
Hi, Dr. Shah. Thanks so much for taking my question today. So going back to that guidance, are you worried about an uptick in the number of cases if people are just using this as an excuse to gather, even if they're not fully vaccinated, or maybe they say, oh, well, I had one, so I'm good now. Are you worried we could see an uptick in the number of cases?
That's a risk, Allison, but that's why I wanted to take a moment to walk through it. And the guidance, as it says, what the science supports doing is only going down that road of gathering with others if you've been fully vaccinated, not if you've had just one dose. And it doesn't right now open the door to gathering in large groups. Could there be gatherings that are outside of this scientific recommendation? It's possible, Allison, but at the same time, what I think Maine people have shown is that when presented with the common sense science, they can follow it. That's one reason our case rates are as low as they are compared to other states. I trust everyone in Maine to understand where this is coming from and what the best way to put it into practice is.
Right, and has the CDC done any more planning on when they are going to vaccinate incarcerated people in jails or prisons? Are those who are in those facilities who are 70 or 60 years or older, have they been offered a vaccine?
I'll answer that question. We are working with the Department of Corrections on a plan to vaccinate all age-eligible people, and as soon as we have the details, we'll announce them.
Great, thank you both.
Thanks, Allison. Let me turn it over to Steve Missler next.
Thanks, Dr. Shah. I know you mentioned earlier in the briefing that vaccine inoculations are accelerating, but I believe last week you had mentioned that things had slowed down and you were trying to figure out why. Have you been able to do that? And can you name what was happening?
Yeah, there were a few things, Eric. It was a question from Eric Russell, which is why it stuck in my head. Steve, we asked our vaccines teams to take a little bit closer of a look. There were a few things happening. One was the launch of 2 large-scale vaccination sites, one in Sanford, the other at the Expo. Those brought a lot of capacity online. Here's what I mean by that. Some of the larger scale vaccination sites entailed moving vaccination from a hospital to a public facing site. But these two sites in particular added to the capacity. So that was one big change. The other is that we've taken some time over the past 4 or 5 days to work with providers to make sure that they're reporting to us in as timely as possible within 24 hours, all of the vaccinations that they administered, what they've got on hand, so on and so forth. So our numbers can be as accurate as possible. So those were two things that we found having opened a new site, bringing on that capacity, and working with providers to make sure that their numbers that they report to us were as timely as possible. Those are two reasons why our numbers more accurately reflect what's going on.
Okay, so just to clarify, it sounds like there may have been some lag in reporting from providers that made it seem like we were going slower than we actually are. Is that fair to say? Or
that's an element of it, Steve. Yeah. Though the bigger thing that I think has accounted not that I think the larger thing that has accounted for the acceleration is the activation and the bringing online of 2 large-scale public vaccination sites.
Okay. And then one other question, I think last week you had made the decision to divert doses, I think 1,100 or so from Walgreens. What is going on with Walgreens? This has happened a couple of times. Can you give some specifics about what struggles that retail chain may be having that's, forcing you to pull the trigger and divert those doses?
Sure, Steve. So you're right. Throughout the vaccination phase of the pandemic, what we have done with respect to retail pharmacies in connection with their partnership to vaccinate in long-term care facilities, and I want to stress the doses that we moved were in connection with that partnership. When they have not been able to give us a firm date on the calendar when those doses would be used, we have said in effect, hey, we've got arms that we can put those into now. So we've done that with CVS, and recently, as I mentioned last week, we've done that with Walgreens. When the time comes when those doses are needed, we make sure that they are available. What's going on is that as that long-term care partnership has started to wind down, what we and other states have found is that there were a lot of doses allocated to that program based on initial projections from the CDC. But when it came time to vaccinating, not all of those doses were needed. So we've been going back to what we said we would allocate and then moving those back into our general pool for use, say, at some of these larger scale sites.
So there's not anything. Oh, I'm sorry.
Yeah, I was just going to add that we have been monitoring how Walgreens has been doing in the second program, the U.S. retail pharmacy program, and that's been going quite well. We know that they, along with Walmart and Hannaford, have been directed by the president to really take on that group of childcare workers, school workers who are newly eligible under the president's directive. And we've been pleased with the way all of our pharmacies have stood up to the task. We also thank Walgreens, who continues to do its rapid testing, its antigen testing in partnership with the state of Maine.
Okay, so it sounds like part of the reason they may have just received too many doses and couldn't schedule as many appointments as they had doses. Is that fair to say?
Yeah, you are correct, Steve. This is, although earlier on, back in December, January, Commissioner Lambrew and I expressed concerns with the pace of vaccinations, both directly to CVS and Walgreens as well as publicly. What I think is happening here is that there were doses that were allocated but not necessarily being needed. As soon as we saw that, again, last week, we saw that there wasn't a time and a place for those 1,170 doses of Pfizer. So we said, here's where we want them to go.
Got it. Thanks so much.
Yep, thanks, Steve. Let me turn it over to Amy Brown next.
Thanks, Dr. Shah. I'm not sure if this question is for you or for Commissioner Lambrew, but will the drivers who are going to be bringing people to the vaccination sites be fully vaccinated themselves?
So in our plan, we have in phase 1A, formerly called 1A, vaccinated publicly facing healthcare personnel, public safety personnel, as well as long-term care residents. We are now in our mode of an age-based eligibility. So any personnel, no matter where they work or over the age of 60, qualify for vaccination. We don't have a special vaccination category for transportation of all different types. All that said, we do require that any of the drivers and any of the people who are getting rides to and from vaccine clinics wear their masks, maintain distance when possible, use the appropriate cleaning. So we will keep people safe as we get them to and from the vaccine clinics. And we look forward to the day when every worker in Maine can get vaccinated.
Okay, so are there any recommendations about windows being open, any other safety steps that they can take? Because you obviously can't really distance in a lot of vehicles.
Yep.
I mean, I think Dr. Shah, you want to speak? Go ahead.
Yeah, Amy, it's a great question. Something that we've been thinking through and talking about. Ventilation really does matter in situations like this. So it's still chilly outside, of course, even though it's going to be a nice day and a nice week. But where possible, opening the windows as much as can be tolerated, having the fans going, having as much air circulation and ventilation, it really does help reduce any possibility of possible transmission.
Okay, thank you. And then is the state now receiving enough doses to allow the age-based rollout to continue as originally anticipated, despite the teachers being in the mix as well? And do you know what percentage of the people 70 and older have received vaccines at this point?
So maybe I'll begin, and Dr. Shah, you can jump in. We're closely monitoring it. As we said last week, while we were grateful we got a whole lot of J&J vaccine for last week, this week that big amount has gone away. So we have a small increase of Pfizer and Moderna doses for this week, but not the Johnson & Johnson vaccine that we'd gotten previously. So we are very closely monitoring. On where we are with regard to people ages 70 and older, we provided 74% of them a first dose and 34% of them a final dose. And we are making progress on the 60-plus-year-olds as well. To date, we are at nearly half, 49% of people in Maine age 60 and over have gotten their first doses, and about 22%, 1 in 5 people ages 60 and over have gotten their final doses. So we're cautiously optimistic that we can continue to follow the plan that Governor Mills laid out to move to people in their 50s in April.
Great. And just quickly, one last quick thing. Could you say the phone number again for people who may need a ride?
Sure, I'd be happy to. Again, for people, and this is people who struggle to get to and from vaccine clinics, if you're not on Maine Care, you can call 1-855-608-5172 to reserve a ride. As a reminder, do it at least 48 hours before you have a scheduled appointment. Do it when you actually have an appointment in hand, so you can give the information on where to go and when to go. And again, when you get into that car, please wear a mask. When you get to your vaccine clinic, please wear a mask. Thank you.
Thank you.
Thanks, Amy. We turn it over to Chris Costa next.
Hi, Dr. Shah and Commissioner Lambrou. First wanted to ask about Somerset County. It appears to be one of the counties in the state that's lagging behind the most in terms of the population getting a first dose. Is the state putting any efforts concentrated in Somerset County to increase that? And I'm also wondering, as part of that, does the lack of Johnson & Johnson vaccine, which we know is helpful because it can be spread far from hospitals, doesn't require the ultra cold storage, the fact that we're not getting that, does that hurt any of those possible efforts?
Yes, as to both questions, Chris. So let's first start with access and points of access there. We've been, for a few weeks now, publicly as well, we've expressed concerns over just the numbers you've mentioned, not just in Somerset County, but also in Oxford County, and to a slightly lesser extent in Washington County as well. And so what we've done is, for example, as we have been choosing pharmacy partners to activate, we have made sure to look for partners, be it Walmart, Walgreens, and now most recently Hannaford's, to look for partners that have locations in those counties of concern. And then within the stores that they have in Maine, make sure that of all of their locations, they are able to activate those locations that are in the counties that we have of concern. You're correct as to Somerset, but again, Oxford, and to somewhat of a lesser extent, Washington County remain areas of concern for us. We look at a number of metrics, not just for example, the first dose, but we also look at it by age as well. So what percentage of, say, 70 and over in Somerset County have received their first dose, the same for other counties. So we've started to, and we've tried to give priority to those locations that can administer vaccine in Somerset County and Oxford County and Washington County. Not having the J&J vaccine this week, that does not help the effort. Hannaford's in particular was offering the J&J vaccine. Not having it this week sets them back. We were also working with EMS clinicians to do on-site clinics open to the public, particularly in those areas of need. But again, not having the J&J vaccine makes it even more challenging. Let's hope that in the near future, we won't be having to make these difficult choices. There will be more than enough vaccine to go around, but right now that remains an area of concern.
Okay. And then I had a second question for you regarding, we had talked back in mid-February about the efficient and full use policy of vaccines to make sure that a single dose does not go to waste. We've heard from some teachers who have been trying to schedule their appointments through the federal retail pharmacy program, some who have struggled to get an appointment, and some who have found that by calling the pharmacy and asking to be put on a waste list, WASTE, they can basically get a same-day callback, allowing them to go to a nearby location and take an appointment that may have been canceled or a file that may be opened, and there may be doses that at the end of the day would have otherwise been thrown out. Has the state, one, updated its efficient and full use policy to match the new age-based approach and the teachers? And two, is there any more organization that will go into that?
Sorry, Chris, could you restate your latter question? Is there any more organization that will go into that?
Yeah, sure. I guess I'm just wondering, there were people who were curious about kind of how the hierarchy works for, who gets the call back first. I understand that under the federal program, it was that any appointment at a federal retail pharmacy program should be open to teachers regardless of age. But I think some teachers were curious if age would eventually play a factor in those callbacks.
Sure. I can start, and Commissioner Lambert and I have worked very closely on this. Let me first start, Chris, by though you didn't ask this explicitly, I want to just make sure I'm clear. Although we have continued to make updates to that full use policy, it is not related to the inclusion of teachers among those who are eligible, for example. We've continued to update that policy based on feedback that we've received from providers, from vaccinators, on ways that we can make it more in tune with what's happening on the ground. And we've done so because we always are striving not to have a single dose wasted. The policy contains some steps for providers to follow in the event that as they near the end of the day, they have extra doses that they project being on hand, how they should think about who should get those. And that's how we've tried to make sure that not a single dose gets wasted. So that's, and where we've gotten feedback, we've tried to incorporate those, but it's not a direct function of, say, teachers now being included.
And what we have done in that guidance is mirror the same guidance that we have even within an eligibility category, which is a site has a choice of trying to prioritize people if they can, who are at higher risk, for example, if they're older or have some sort of medical condition that puts them at risk. They can prioritize people who are otherwise vulnerable, have challenges getting to a site. Maybe they struggle with transportation, which hopefully we'll be addressing today, or have some other challenge. So sites can prioritize those people, but they can't prioritize people based on a relationship with the organization, friends and family, or other characteristics that would preferentially put people in line, and that's both within an age category and in this full use policy. So we mirror that in both places. I would say, though, we don't have a one size fits all. So while some pharmacies have the policy that you described, others don't, each of the sites has their own policy to ensure that no dose gets wasted.
That's a big help. Thank you both.
Thanks, Chris. Over to Morgan from WABI.
Hi, Dr. Shah, Commissioner Lambrou. Thank you for taking my questions today. So speaking of teachers, we've heard from some teachers who are having trouble even getting vaccinated. For example, there's a teacher in the Waterville school system who's 55, and she's been told by Walgreens and other places that they are only taking 60 and above. Can you talk about the effort, how the effort is going to vaccinate teachers, and if there are any updates on the teacher and childcare worker clinic coming up?
So I'll begin by saying uh, we ask teachers and school staff and childcare workers, as we ask older Mainers, to recognize the fact that we still have a limit in supply. It will take some time for every eligible person to be able to get an appointment. So we know it's frustrating, but we urge patience. We're hoping that the supply of vaccine that we get next week will be bigger than this week, and hopefully by the end of the month will be significantly bigger. So we do ask for patience. As a reminder, there's three ways that teachers and school staff and childcare staff who are newly eligible under the president's directive can get vaccinated. Number one is the U.S. Retail Pharmacy Program has directed that Walgreens, Walmart, and Hannaford in Maine make new appointments, newly offered appointments available to all people in this eligibility group. Second, even before the president's announcement, Governor Mills, out of an interest in vaccinating older teachers, directed myself, the Department of Education, to work on special clinics for school teachers and staff who are age 60 and over. Those special clinics are going to be happening mostly on March 12th and 13th and 14th. We're very excited about those special clinics dedicated to older teachers and school staff. And third, all of the sites in Maine under the president's directive will slot teachers and childcare workers into their sites, but not preferentially in the same way that they would a 60-year-old or a newly hired healthcare worker. So there's three ways for teachers, school staff, and childcare to get their vaccine in Maine.
Thank you. I'd also like to ask about the immunocompromised, specifically cancer patients. If there's any move to or any more advancement in potentially adding them in to get vaccinated. I asked because I was reached out, a family reached out to me, a 21-year-old young woman in Glenburn. She is dealing with Hodgkin's lymphoma, and they're very concerned about getting her a vaccine. She's also concerned about other cancer patients being able to get their vaccine. She's facing stem cell transplant this summer or this spring, later this spring, and they're just wondering, they understand the age-based approach. They're wondering if there's any sort of solution.
I can start there, Morgan.
Okay.
That's incredibly difficult, and our hearts go out to those like the person in Glenburn that you mentioned. It's so hard, particularly on top of contending with lymphoma, stem cells, and then now having to struggle to find and access a vaccine. It's so incredibly difficult. Commissioner Lambrou and I have discussed this. We are fully aware that the age-based approach means that some folks, like the 21-year-old who you mentioned, right now are not eligible. We are hoping that if we can move as quickly as possible, we'll soon be in a position where folks can be offered the vaccine, where we are not supply constrained. In the meantime, we're thinking about other ideas. Nothing to announce. We haven't made any changes right now because we also know that there are a number of older Mainers who are themselves at a higher risk for death that we're trying to balance off of. So it's a really, really difficult problem. I wish I had a better solution right now, here today. What I can offer is our understanding and our compassion for the challenge they face. And hopefully the vaccine supply will ease and grow significantly so we don't have to make this choice in the near future. Let me turn over to Joe Lawler next.
Yes, hi, thank you. Just had a couple of numbers questions, and then I have a follow-up. Commissioner Lambrou, on the rides program, do we have, I know it hasn't started yet, but do we have a sense of how many people might take advantage of this? Are there any estimates of that yet?
We actually don't have any estimates yet. We know that to date, there's been a tremendous amount of support for rides on a volunteer basis. Mentioned that we'll be partnering through Motive Care with the community action programs. They've been providing volunteer rides to vaccine sites to date. We do know pre-COVID that transportation in Maine has been a challenge. We know that this has always been a problem. We don't have the type of public transportation system that other places do. We're a very rural state, which means it's harder to get to some of these sites. So we don't have a way to quantify it, but we know that there's a need. That need predates the pandemic. And we are just very excited to be able to newly offer these rides to people who otherwise would be challenged getting to and from their vaccine clinics.
Okay, thanks. And my other numbers question is just, I know that the J&J vaccine is supposed to be constrained supply for at least another week. Dr. Shah, have you heard anything on whether to expect any substantial increases in supplies of Moderna and Pfizer next week?
Great. Thanks for raising that, Joe. The latest that I've heard, based on conversations that I've been lucky enough to sit in on with our federal colleagues, is that for the upcoming few weeks, the increases in both Pfizer and Moderna are thought to be modest. That is to say, gradual increases in Pfizer, which relative to Maine may not be more than 1,000 or 2,000 doses per week. And I've also been told to expect even lower percentage increases for the Moderna vaccine. From what I've been briefed on, both suppliers, both manufacturers are ramping up their capacity, and as well as making improvements in their supply and their production capabilities, that it may be a little bit of time before we at the state level start to see those. The other thing, Joe, just since you mentioned J&J, we have been told that their states, not just Maine specifically, states might see a little bit of J&J next week, which again, scaled for Maine, may not be very much at all. And then the week of the 22nd of March, it's not clear what the supply will be, but then starting the week of the 29th and then into the week of April 5th, to expect higher volumes of J&J coming into the state. So the bottom line is perhaps modest increases for the next week or two.
Okay, thanks. It sounds like the big supply increases will happen end of March, beginning of April. Okay, so my follow-up question is just about schools, and I'm wondering with teachers getting more vaccinated, and President Biden has made it clear that one of the goals of doing this is to have more in-person learning. And even if the guidelines don't change, I'm wondering if the improvement in the weather, say in late April or early May, might allow for some flexibility for schools to offer more in-person learning. You could have more, maybe lunch be outside. You have the opportunity to open windows. I'm just curious what your thoughts are on that.
Yep. So I'll start, and then Police Commissioner. So Joe, both of the factors that you mentioned, as we get into warmer weather, be it more ventilation in classrooms, as well as trying to move certain activities outside, be it lunch, be it even classes themselves, that we hope will help. Another benefit of more widespread vaccination within schools among staff and teachers is a little bit less of a need for example, teachers and other staff to be out if they've potentially been exposed or were in a classroom where there was someone who was positive. So we can have more staff in school and then perhaps fewer outages as a result of that. There are still some challenges. For example, the physical spacing, that remains a challenge, but we're hoping that, as you say, as we get into warmer weather with more widespread vaccination among those staff, we might be able to be on a pathway toward a little bit more in-person education.
And we are closely watching what's going on in Washington, because the American Rescue Plan, or Act, I should say, does have support for schools in it that could expand those options even further. So we're proud of our schools here in Maine. We've done a good job of promoting in-person learning to try to do our best, but we're hopeful that we could all do even more with the two tracks of vaccination on one hand and more support for schools on the other.
Mhm. And Joe, I know this wasn't implied in your question, but something that Commissioner Macon has impressed upon me that I think is worth noting. A lot of the discussion nationally is around reopening schools, but I think it's important to note that schools in Maine have been open. The notion that all schools are 100% remote in Maine does not hold true, as it does in some jurisdictions. The question on the table for us is how can we move to even more in-person education? Let me turn over to Stephen Porter next.
Thank you, Dr. Shah and Commissioner Lambrou. York Hospital will offer one of those special COVID vaccine clinics that Commissioner Lambrou was talking about this Friday. It's exclusively for people who are both 60 or older and employed by York or Kittery schools. We know there has been some confusion and frustration over how this age threshold works. So if I'm understanding correctly, school and childcare employees who are 59 or younger are currently eligible for COVID vaccines in Maine, but only through those pharmacies that are part of the federal government vaccine allocation. So I guess my question is, if that's the case, why doesn't Maine consider school and childcare workers eligible for the state's allocation? What's the rationale for distinguishing between those two lanes?
So
Yep. I'll let you start, Commissioner. Yep, go ahead.
A little correction of what you said. So it is the underlying fact is that a teacher, a school staff person, a child care worker, and those are licensed child care workers. You need to go register on the state registry to bring proof of your being a licensed child care worker in the state of Maine. All those individuals are eligible at all vaccine sites in Maine. The difference, though, is that number one, those retail pharmacy chains that we mentioned, Walgreens, Walmart, and Hannaford, are required to offer new appointments just to that group. So they're preferentially getting appointments there. And secondarily, before the president made his announcement, Governor Mills and her commitment to help older teachers set up these special one-time clinics like the one that you mentioned for age-eligible teachers and school staff. And those are coming from the state's allocation, not from the extra doses that the federal government is sending to our retail pharmacy chains out of a commitment to our older teachers. So all eligible childcare workers and school staff and teachers should be able to get a vaccine at any one of our sites. But the difference is they're getting special opportunities when they're older at our clinics and through the chain pharmacy because of President Biden's directive.
So would it be correct then that a 59-year-old teacher in York can't go to this special clinic at York Hospital, but can go to the Sanford mass vaccination site?
Yes, or to Walmart, Walgreens, or Hannaford.
Understood. Thank you. And my second question, I spoke with a mother in Kennebunk whose 18-year-old son has kept an especially small bubble throughout the pandemic because he has Down syndrome. And considering the health complications that can come with Down syndrome, the family was eager for him to be vaccinated under phase 1C of the former vaccine rollout plan in Maine. But when the administration announced a strictly age-based approach, that effectively pushed him to the end of the list. So I'm wondering, and I know Commissioner Lambrou, you mentioned vaccination sites might be able to prioritize people based on health status. I'm not sure if you can clarify that, but I'm wondering, is there anything that your team can do to reprioritize Mainers with Down syndrome or other young adults who are at high risk of complications?
Sure, and as Dr. Shah said about the young woman with cancer, we appreciate the desire for vaccines for everybody, especially people with health conditions or disabilities. We appreciate the frustration with what has been a limited supply of vaccine at this moment in time based on what we presented a few weeks ago, looking at different groups of people, which groups of people are at most risk of serious illness or death from COVID-19. And for the most part, what that evidence shows is that age is that factor. We are still working our way through our 60-year-old plus. And as I said earlier, within age eligibility categories, that's where that kind of prioritization that I mentioned earlier could happen. So you could, within an age category, prioritize people with cancer. And for example, we did provide vaccine doses to one of our major outpatient oncology practices for exactly that purpose, so that they could get to those age-eligible people quickly who have those multiple comorbidities. We're hopeful that the supply situation changes, and that means we can more quickly move our way through our age categories, more quickly get to people with medical comorbidities that maybe make them, or medical conditions or disabilities that may make them more vulnerable to COVID-19. All that said, we're not there today.
We turn over to Jessica Piper next.
Thank you, Dr. Shah. I wanted to back up a little bit. You went over some of the case and hospitalization numbers at the very beginning of this, and I think we've sort of seen a pattern where cases were declining really steadily since January, and for the last 2 weeks or so, they seem kind of stuck at this higher level. And I'm wondering if you could address maybe why you think cases have kind of remained constant and what the current drivers of transmission might be.
Sure. So that's a good question, Jessica. I've asked some of our team to think this through a little bit more. Generally speaking, when you see that degree of stasis between case numbers, between day and day and day, where we're all within that same band of new cases, that tells you epidemiologically that number, the R number that we've talked about previously, is hovering right at around 1. That is to say, for every new case, the person with COVID gives it on average to 1 new person. And so long as we're staying in that 130 to 170 cases per day, that suggests a static degree of transmission. And that transmission continues, based on the case investigations that we're doing, to be occurring within and across households. If vaccination rates continue to increase, the goal there is to try to drive down that R number to below 1. We can start reliably having it be below 1, the number of new cases will shrink slowly but steadily over a multi-day, multi-week period. But right now, we are at that relatively stable plateau for now.
All right, thank you. And then a question about vaccines. You talked a little bit about, looking into the throughput at different sites. And I'm wondering if you could address when sites are seeing slower throughput, what are like the holdups? What are the factors that might be contributing to that?
Supply. That's what I've spoken with so many medical directors, site operators across the state, and when they are seeing lower throughput, it's almost entirely a function of not having enough vaccine. There are other factors at play. For example, it may be there was inclement weather a couple of weeks ago, as folks recall, on a couple of different days. That can affect daily throughput, although even in Maine, that barely registered as a blip for us. But it really is supply. Supply continues to be the prime determinant of speed.
All right, thank you.
And the final question for the afternoon goes to Patrick Whittle.
Thank you very much. You have my Scout's honor. I will not be attending a rave. A couple of things. First of all, some independent providers, such as Martin's Point, have started offering their own wait lists for their patients, and also for people who are outside of their own network to get in line for the COVID shot. Is the state coordinating with these groups to make sure that they can meet the need? Because there are a lot of independent providers of varying size and scale in the state of Maine, and they're starting to try to get people in lines, which is obviously going to necessitate supply.
Yep, Patrick, the short answer is yes. In specific regard to Martin's Point, I'm in really good contact with them and their COVID vaccination team multiple times per week to get a sense of what their throughput looks like. Do they need more doses? Do they have extras on hand? And particularly about who they are scheduling out into the future. And as you noted, we have requested that these larger public-facing sites open up their doors, not just to their own patients, but to anybody, irrespective of whether they're a patient. As we get more supply, we're hoping to be able to have them call in as many people on the wait list. The challenge that I am mindful of is that some folks have signed up for multiple different sites, which I understand, but we need to make sure that those wait lists, when folks are called, we're utilizing those spaces for folks that truly haven't been vaccinated, rather than offering vaccine to folks who have already gotten their vaccine. That's going to be an IT challenge that we're thinking through right now.
Okay, great to know that. Also, second question is from a reader. You said it a few times that the wise thing to do is to take the vaccine closest to your arm. Is there going to be any kind of accommodation made for folks who do have one that they personally prefer, and is there a way people will be able to know which clinics are offering what?
So I'll start with the latter question, Patrick. One of the many reasons why every single Thursday we publish not just the press release indicating what we've ordered, in quotes, from the federal government, but where it's going, is so that folks have a rough sense of not just how much vaccine is going to a particular provider, but which. Now, that is not the final location. As I've talked about, we move vaccines around the state, load balancing across the week. And so it's possible that a certain provider is allocated 100 doses of Moderna on Monday, but at the end of the week is actually offering Pfizer. So that's not the last word on who's giving out what, but it's at least a preliminary sense of who is giving out what. The other thing that I've started to see and have urged larger scale sites to do is just have a sign when folks walk in indicating what vaccine is being administered that day. And in the visits I've made to vaccination sites, people tell me that that answers about 90% of the questions that people ask when they walk in. That is to say, what vaccine am I getting today? But you raise a more difficult question, or challenging question about choice here. Of course, there's always choice. But right now, with supply being so constrained, being able to say when you walk into a site, I want this vaccine and not that vaccine, we're not there yet. I will also note, Patrick, that one of the things that pharmacists have indicated to me is the operational benefit of a single site utilizing and gaining expertise with a single vaccine. Again, if you're drawing up 1,000 to 2,000 to 3,000 doses per day, each vaccine has slightly different instructions on how you draw it up, how many hours you've got, how it's got to be stored. And what pharmacists across the state have told me is that using a single vaccine at a single site greatly reduces the likelihood of errors in the pharmacy and administration process. So right now, as you've noted yourself with respect to flu vaccines, most folks don't ask the manufacturer of the flu vaccine they're getting when they go to the pharmacy, even though there are very slight variations. Until we see those variations between J&J, Pfizer, and Moderna have clinical implications, I continue to recommend that the best vaccine for where we are right now is the one that's closest to you.
Okay, great. Thank you so much.
Thanks, Patrick. That was the last question for the afternoon. Commissioner, any parting thoughts from you this afternoon?
We'll just say we're grateful that we can begin to get to some of the challenges that people have had getting their vaccine, transportation being one of them. We do urge people who struggle to get to and from these clinics to take advantage of our new option. We also will continue as supply expands to begin to broaden the number of sites that are offering. So in places like Somerset County, like Washington County, there'll be more choices for people. We look forward to those days, but each day we do urge all those people who are eligible to go to Maine COVID-19 vaccines, look at the options for sites, if age eligible, sign up for an appointment.
Thank you, Commissioner, and thank you all for your time this afternoon. We appreciate you joining and getting the latest on COVID-19 for the entire state of Maine. We look forward to chatting again with everyone on Thursday. Until then, as always, please be kind, take care of one another. Talk to everyone soon.